Receiving a uveitis diagnosis often leaves passionate scuba divers wondering if they must give up the sport for good. Uveitis is inflammation of the eye's middle layer, known as the uvea. Many divers worry that ambient pressure changes at depth will physically damage an already inflamed eye. However, because the eye is protected within the airspace of your dive mask, it is shielded from direct ambient pressure changes. The practical dangers actually stem from functional vision loss, the side effects of your medication, and any underlying systemic diseases. This matrix clarifies the choice. Instead of pressure damage, safety depends on functional vision and overall health. Diving requires clarity to read gauges and see hand signals. We can map which stages allow safe diving and which require staying on shore. Safe diving relies on accurately identifying your current medical stage to find reliable windows of opportunity. This flowchart provides a framework to help you locate your specific medical situation. An active flare involves redness, pain, floaters, and severe sensitivity to light. These symptoms directly interfere with your ability to navigate, recognize hazards, or monitor your gas supply. Any active flare represents a temporary grounding order for a diver. Safety changes once the inflammation has successfully subsided. Before returning to the water, your vision must be near normal, the eye must be comfortable, and an ophthalmologist must confirm the inflammation is under control. Waiting for the inflammation to settle ensures you have the visual precision required to manage a dive safely. Medical management through specific treatments adds another layer to your readiness. On our chart, treatment splits into two distinct paths: topical eye drops and systemic medications. Steroid eye drops provide a localized treatment that manages inflammation without affecting your overall physical fitness. Once your vision is stable, these drops generally do not prevent you from diving. Severe cases may require high-dose oral or intravenous steroids. These treatments can cause muscle weakness, mood changes, and a suppressed immune system. These systemic side effects increase your risk of infection and compromise your physical stamina underwater. You should complete these heavy medication courses before returning to the physical demands of scuba diving. Because uveitis is often a secondary symptom of an autoimmune condition, you must consider your ability to handle heavy equipment. We expand the chart one final time to include underlying conditions. Diseases like ankylosing spondylitis or sarcoidosis are frequently associated with eye inflammation. These can lead to reduced spinal mobility or issues involving the heart and lungs. Lung or mobility impairments may cause a diver to fail general fitness requirements, even if their vision is perfect. Some patients also develop cataracts from repeated flares, requiring surgical intervention. Surgery requires significant time out of the water for the eye to heal and for your vision to stabilize. For complex cases, the primary barrier to diving is often the autoimmune disease itself, or the time required for surgical healing. We synthesize these factors into a risk matrix. The vertical axis tracks vision clarity, and the horizontal tracks systemic health. Active flares, systemic meds, or surgery recovery fall into red zones. The ideal candidate stays in the green top right quadrant. This requires settled inflammation, stable underlying health, and a reliance only on topical treatments. When you have that clearance, a few dive day protocols will help you manage the condition. An excellent mask fit avoids putting unnecessary mechanical pressure around the eye socket. Use lubricating eye drops for post-dive dryness, and always be prepared to abort the dive immediately if your vision suddenly changes while underwater. Specialist clearance is required if taking medications like methotrexate or managing diseases like multiple sclerosis. Ultimately, your current management phase dictates your timeline and determines your readiness for a safe and enjoyable return to diving.